Women are using social media to bring awareness to a common yet rarely talked about condition. Ovarian cysts affect about 3 million women each year in the United States. Most go away on their own, but in some cases they can grow and lead to serious complications. They might even rupture or cause twisting of the ovary. In a TikTok video, Raquel Rodriguez appears to be very pregnant, but reveals it's actually an ovarian cyst. Look at that. The video has been viewed more than 1 million times. We spoke to 2 women who shared a similar experience.
I was very surprised when I found out ovarian cysts are common in women.
33-year-old lifestyle blogger Shantae Burkett posted her own ovarian cyst experience to her more than 500,000 social media followers. She wanted to see if other women had similar stories. The response, overwhelming.
I received over 300 messages of women just sharing with me their experience, and girls saying that they even had to go through it at the age of 13, 16. And it made me really aware of what's going on.
Burkett started to have pelvic pain last December. By April, she noticed her abdomen was protruding.
When I went to urgent care, I went in there basically like, hey, can I get a scan of my stomach? Something definitely is wrong.
Doctors found a 13-pound ovarian cyst, the size of a watermelon. Burkett had no prior reproductive medical issues.
It was definitely like, oh my goodness, like this is in me. How did it grow so big?
Most cysts resolve on their own, but about 8% of women under 51 develop large cysts that need treatment. It took 4 hours of surgery to remove it.
I didn't know much about ovarian cysts at all.
Dory Paulino's nearly 4-inch cyst was discovered during an annual gynecological exam.
My symptoms were so subtle and so mild that for me, it really just was undetected.
Paulina's cyst was slowly growing for about 3.5 years before it was removed. She says women need to be better advocates for themselves.
We know ourselves best, so if there's something that you feel that doesn't seem quite right, don't just put it off, don't dismiss it.
NYU Langone gynecologist Dr. Taraneh Shirazian joins us now. Good morning, Dr. Tara. None of this surprises you, obviously. Dory's actually one of your patients. But first of all, explain to us what an ovarian cyst is and how common is it?
Yeah, ovarian cysts are extremely common. They're far more common than we even have numbers for, because many women have these cysts and they simply go away on their own. And so we often hear women will ovulate, they'll have a cyst, it will rupture, it will go away. You know, especially in reproductive age women, it's extremely, extremely common.
So when do you know when there's a problem to the point where perhaps you need to go into a doctor and get surgery? Because we saw, you know, the protruding stomach, but at what point, what are some of the symptoms women should be looking
Pressure,
for?
bloating, definitely growth of the abdomen, definitely visually seeing that your abdomen is protruding is a big warning sign. You know, you don't want to watch your abdomen grow. It should not be growing over time. That needs to be assessed. You need imaging. You need to be seen by a GYN. And of the rapidly growing masses, we either see big ovarian cysts or fibroids. So those are the 2 big pelvic masses that are relatively common.
Well, you may not be surprised, but I looked at that video and my mouth fell open because I didn't know they could get that big. I've had cysts, but it was something that, you know, you think you can hold in your hand. When it gets that big, that quickly, is it dangerous?
Yes. So this is likely
But these women are clearly surviving. The one lady's singing and dancing.
Right. This is likely a mucinous cyst. Mucinous cysts get this large, and they affect women between 20 and 40 mostly. They can get quite big. 80% are benign of the mucinous cysts. 17% are borderline. So because they get so big, they could have little foci that are abnormal. And then the remaining 3–4% are cancer. So it's not a huge cancer risk, right? But they could be borderline, and clearly they're creating lots of issues. If you
have one removed, are you more likely to have another, or I mean?
That's a good question. So the recurrence risk is roughly 15 to 20%.
Yeah.
So if you have one ovarian cyst, you are at more risk for another. But I think the thing I found most disturbing was you definitely don't want to watch or monitor.
That's what I didn't get, Tara, that you're watching this thing grow and you know you're not pregnant.
Right.
How rapidly does it grow?
Mucinous cysts grow quite rapidly. Over the course of a year,
Yeah.
It can grow from like a few centimeters to, this is probably up to 25, even 30 centimeters in size.
Does this have an impact on fertility?
It can, because you may need to lose that ovary, right? And if there's any borderline area to it or cancer there, you might even need to lose the other ovary. So it is very concerning.
Do you think during the pandemic, a lot of us have put on weight? Do you think women are thinking, well, it's really nothing because I have been eating more and I am getting a little chubby?
I have been seeing that so much right now in the office. So many women coming in saying, oh, I didn't think there was an issue. I thought I was just putting on the COVID-15 or COVID-20.
COVID-25.
Right.
Yes.
And in fact, it's growing fibroids or it's growing cysts. So those are the things I see and treat. So please come in.
Is it hard to detect? I mean, for doctors even, do you miss them? No, it's pretty easy.
You don't.
No, I mean,
because I'm wondering why more people aren't talking about this.
Yeah.
Anything we can do to prevent it?
There's no real way to prevent them. I would just say pay attention to your body. If you feel like you're bloating, putting on weight, regular bleeding, sometimes even, make sure you come in.
All right. Dr. Taraneh Shirazian, thank you so much for being with us this morning.
Thank you.
Thank you.